Hi, my name is Alan Lieberman. I'm a co-founder of the Alifia app. I'm a consultant in pain medicine, and I'm doing a series of videos around chronic pain and fibromyalgia and health coaching. So thank you for tuning in and listening. I'm going to talk to you now about why drugs and pharmacological management of fibromyalgia isn't enough and what other treatments you should consider um, on that journey to helping you manage your fibromyalgia. So, and I've used this metaphor in other videos. Information coming to your brain around pain is not just one signal. Think about it as routes into a city centre. You can go into central London down the Thames. You can fly into Heathrow or Gatwick or Stansted. You can cycle in. You can walk in. You can go down through the canal to get into central London. You can drive in. You can take a motorbike. You could take a helicopter. There are lots of routes in. And those are like the pain pathways going into your brain and the sensory pathways going into your brain. Now, clearly, if the M25 and the feeder roads into centre of town are blocked, there'll be a lot of traffic jams, but people will still get into London via the routes. They'll take the train, they'll take the tube, they'll walk, they'll cycle. And in the same way, when you take a drug, drugs work on specific pathways. They block specific receptors, they block specific routes, transmission pathways. But no drug can block every pathway. So signals still get through. And the problem with those drugs that we give you is that not only do they block pain pathways, but they can also block other pathways. They can make you constipated, they make you nauseous, they can make you itchy, they can make you sleepy, they can make you groggy, they can give you a dry mouth, they can give you a fast heart rate. So they can give you lots of other effects as well as the pain effect. And often the pain effect isn't that great, and all the other effects, because of the increasing dose, make you feel worse rather than better. You know, for example, the gabapentinoids, gabapentin and pregabalin, can make you feel very hungry. And you can put weight on because you go into the fridge more because it gives you that feeling of being hungry. Whereas the new jabs, the Ozempics of this world that are so popular, make you feel less hungry. So they do the opposite of what Ozempic does. So clearly, medication isn't a cure for fibromyalgia. If it is, I wouldn't need to do these videos and you wouldn't be struggling. You'd just be popping one tablet. So we know that that doesn't work. So we have to start thinking about all the other pillars, therapies, understanding bits that can help you adjust your lifestyle and get you back into a better rhythm, a better framework to have a healthier and happier life. And I'm going to talk to you a bit about those in this video coming. So my belief is that fibromyalgia starts off with a diagnosis. And you do that using the questionnaire, going to see a clinician who's informed about fibromyalgia, talking to them about your symptoms. As I say, filling in the questionnaire, being examined, and then if your story fits, being given a diagnosis of fibromyalgia, which isn't a disaster. It's just a description, a set of words to explain to other doctors, to explain to the wider world why you are as you are. And you are as you are with fibromyalgia, as you're well aware, because everything hurts. It hurts when you move around. It hurts when you bend. It hurts when people touch you. It can be quite hurtful sometimes and not very hurtful other times. Activity can make you feel very drained. You can feel exhausted most of the time. All of those symptoms. I'm not going to discuss that now, but that's what fibromyalgia presents as. And you need to get a diagnosis. And we've covered that in other videos. There's lots of information on the internet about that. But suffice to say, it's a medical process to understand why you're presenting as you are, because there are other things that can present in similar ways, like low thyroid function, and a whole variety of other issues which need to be sorted out. Once the diagnosis is made, the next step, in my opinion, is to have a firm and thorough explanation of what's caused your fibromyalgia. And I've done another video around that because that's a good 30-minute conversation. But essentially, what that means is that most people, in fact, probably all people with fibromyalgia, and it's 5% of women and 1% of men, have to have a genetic predisposition in the same way that people get genes to make them tall or short or fat or thin, or being able to run faster or run slower or do endurance sport or not do endurance sport. There's lots of functional characteristics you inherit from your genes, And unfortunately, over-processing pain and becoming someone who has fibromyalgia has a genetic predisposition. We know that it's inheritable. There's lots of work around that. And we know that that inheritability is probably passed on through both through mitochondrial dysfunction and through the epigenetics, which basically are the areas of the genome that control the genes that make your proteins. So you need to have epigenetic vulnerability. Then, unfortunately, it seems to be much commoner in people that have poor childhood histories. That doesn't mean your parents were horrible to you, but it means that you've had a nasty disease in childhood, that you've had some type of stressor in childhood, and that can be everything from horrible sexual abuse to being bullied at school, having traffic accidents and trauma as a childhood. All sorts of issues can trigger this, as we understand it. You then may not develop fibromyalgia unless you have a further trigger in adult life. So you need to be essentially, as people locally say, you need to have the genetic risk. You need to be softened up in childhood with it, and then you need to have adult challenges. And at the end of that journey, you then develop fibromyalgia, but that needs to be explained to you. Once that's explained, the pillars of how you manage fibromyalgia then need to be put in place for you. Okay, so the first pillar is movement and physical activity, which seems counterintuitive because it hurts when you do everything. But essentially, you need to retrain your brain to allow you to move and to exercise. And that can be really difficult because it hurts. And I get that. But unfortunately, the less you do, the less your body wants to do. And there is a whole aspect of encouraging people to do more slowly in a paced way, i.e., it's sustainable, and a goal orientated way, i.e., you're trying to push yourself a little bit further, but not so far that you can't get there. So that you need to push a little bit, but rein in your expectation, but keep doing it. And that's so hard to do over the long term. It's really difficult, which is why I developed Alifia, the coaching app, to help you on a day-to-day, week-to-week basis, because I know that your doctors don't have the resource for this, the nurses don't have the resource for this, your significant other, your family don't have the training or the time, they've got their own problems. So the app is there as your independent friend just to focus on helping you adjust your lifestyle. That's what it's for. And that's why I think it's useful, because center in the center of managing fibromyalgia are these small changes that occur all the way through your journey. And honestly, your journey to having fibromyalgia has taken years. The way that your genes exhibit themselves has changed. And in order to force your body to change again, the changes that you need to make need to be long term. And my understanding and my reading of the medical literature is that health coaching is the only way that can manage for most people. So the next important thing is getting your mindset right. And that's not just me saying or someone saying pull yourself together, it's not that bad, because clearly that's a horrible thing to say to someone. It's about explaining to people and getting people to understand the triggers that make them depressed and make them anxious and dealing with all of that. It's about reframing your thought process to have a happier mindset and to enjoy life more. Because at the end of the day, what's it about? You want your mojo back. You mustn't let your mojo get robbed by the drugs that we're giving you, or the messaging that's coming out of the healthcare system, or the fact that you're being ignored, or the fact that you don't understand what's wrong with you. So putting all of these little things in place and correcting them all, corner by corner, that's where we improve with fibromyalgia. It's not one moment of revelation. It's small changes through your life. And again, that's why I think health coaching helps. And that's why we've developed the app, because the app's got information in it. It explains things to you. You can listen to me talk to you again and again so you understand each point. You can ask questions in the app if you don't understand what's going on. That's what it's there for. And real human health coaches will feed back to you and explain to you why you're struggling with something. It's a results-based service. You challenge us, we give you some answers, and we push you a bit. And that's all done within a secure messaging system. But it's really important to get you happier. And only you know what makes you happy. Only you know what's going to make that box get ticked for you. And it's a difficult question. I accept that. Plenty of people in very big houses are depressed. It's not about your wealth. It's about your expectation and how you find joy in life. And That is probably sounds like a religious thing, sounds like a philosophical thing, but it's true nevertheless. There's loads of data to show that if you're depressed and if you're anxious, your long-term healthcare outcomes, cardiovascular disease, frailty, muscle mass, all sorts of things get reduced if you're miserable. And it's so important to get joy back into your life. And that's another reason why I developed the app, because people need help and people need help long term. And it's just too much for your partner to help you with. And it's an expectation of the healthcare system that's deeply unrealistic. So the next thing is, what else do you look at? Well, sleep, stress, and lifestyle. They're the big things that drive us mad. I wear this Whoopie thing to look at my stress levels and my sleep. You don't have to, but wearable data can be fed through the app to inform the coaching, but it's not necessary, but it can be interesting. But really, you know what time you go to bed. Everyone knows what time they go to bed. Everyone knows what they do in bed, and everyone knows what time they get out of bed. And we all know that your brain goes into rest mode in your sleep time. And clearly, if you're not getting quality sleep, if your day-night life cycle is chaotic and you're sleeping on the couch downstairs and you're going to bed at 3 in the morning and you're playing video games because you've got pain and because you're not exercising during the day, so your body's not into a good lifestyle, and because maybe you're drinking a little bit too much or smoking substances that society doesn't approve of, that is going to interrupt your lifestyle. But that's how people live. And you need to reflect back to yourself. If you want to get better, you need to replace your chaotic lifestyle, if it is, with a regimented lifestyle and boil it back to the basics. The good Lord, evolution, whatever you believe in, intended us to sleep and then wake. And maybe sleep a bit during the day. Sleep is such an important part of the healing process that we forget about it. We don't realize the harm that we're doing to ourselves by not sleeping. So sleep, important. Stress. Stress is actually quite good for you if it's controllable and if you understand why you have it. I have a stressful life because I do lots of things, but I enjoy it. Stress becomes pathological. Stress becomes harmful when it's outside your control, when it's things that you can't influence, when you're being made to do things that are difficult. And so unpicking that and working out how you reduce those stresses and how you respond to them in a better way, that's key. And where it's possible, you need to reduce the stresses and move into a lifestyle that you're happier with. And that's what the coaching app also helps you identify and deal with. Now, one of my friends said to me, Ilan, you need to surround yourself with radiators, not drains. And I think that's great advice. You want to surround yourself with people that encourage you, that make you feel better about yourself, that activate you, that give you ideas, that bring joy into your life. And you want to remove the drains in your life, the people that make you miserable, where that's possible. Now, I'm not suggesting that you divorce everyone and chuck out your friendship circles, perish the thought. But you do need to recognize what triggers you so that you can plot a course to being happier. And that's what the app's also about. It's about prioritization. It's about being able to tell a trusted third party what's driving you mad in confidence, and then being able to feedback sensible suggestions to you. The app isn't clinical. It's not a psychologist, but it is psychologically aware advice that you would get from a sensible friend or a sensible spouse or a sensible partner or a sensible healthcare professional when they're not working as a healthcare professional, but just someone giving you general good advice. And that's the way to think about this. Many of the problems that people have are problems that they just can't sort out in their head themselves. They don't need a healthcare professional, but they do need a sensible friend. And that's what the app does for you. It is a sensible friend to give you sensible advice. The other thing that it does for you is it provides understanding. In your life, you lack understanding, I think. That's what I see with patients with fibromyalgia. They lack understanding. They have very significant amounts of stress. They have dysfunctional days and nights, and they are just miserable with their pain. And you need to solve for that. You need to have joy back into your life. You need to understand why you're feeling so poorly. And then you need to have some sort of pathway, some sort of light in the darkness to walk towards, to give yourself something to aim for. Otherwise, it's just the circle of misery. And I'm trying to help people solve for their circle of misery, essentially. And in this journey, it will just take time. For example, many of the people I see have IBS, irritable bowel syndrome, and really uncomfortable guts. And that is often an example of how the modern lifestyle with processed foods, with poor eating habits, forced either by the fact that you can't afford to buy decent food, or you don't know how to do that. You don't know about decent meals. You don't know about how to cook. You don't necessarily have the resources for that. That is all solvable for, but it needs to be identified. It needs to be understood. Your bowel flora, and I've said this in other videos, it's like having a pet inside you, 2 kilos of pet, millions of organisms that have been with you since you were born and are there actually after you die. It's a symbiont. It's this alien that lives inside you, essentially. And if you don't have a good conversation with it, if you aren't mates with the bowel flora, with your microbiome, if you're not giving it decent food, if you're not resting it properly, if you're constantly feeding it with rubbish, it's going to kick back. And there is loads of data now to say when it kicks back, it affects your cardiovascular system, it affects your mental health, it affects your immune system, it drives inflammation, and possibly could even cause cancer. And so having decent diet, eating wholesome food, eating unprocessed food, learning to cook from decent ingredients, not overeating, and having gaps between your meals, having plenty of water, not taking in what's constantly pushed in the advertising industry in terms of fast food and processed food and food that honestly your grandmothers never ate, your great grandmothers never ate, but we're consuming it now. That's not good for you. And you need to go back to having wholesome ingredients, cooking for yourself, making things as one of my children said to me, "Dad, what you're really saying is if it comes out the ground and goes into your mouth, that's good for you." And I said, "Yeah, you're allowed to wash it." But that's essentially what we're saying here is that you need to boil this back to make your lifestyle more healthy. And there are so many aspects of people's lifestyle that need chopping up and changing that you cannot expect the healthcare system to deliver this to you. And that is again why we developed the app, so that over time, and it is going to take a while, 1 or 2 years to get yourself going, or it may be a longer term project because you've developed fibromyalgia maybe over the last 5, 10, 15, 20 years. You cannot expect it to be turned off immediately. And that's why we tried to make the fibromyalgia app cheap and affordable, and why it's there for you to ask questions of it the whole time. And it won't get sick of you. It won't give you a short, sharp shrift. It won't ignore you. It's there to support you. And that, I think, in a nutshell, is why we've done it. It's to support people, to make people's lives healthier. Because my belief is that we've abandoned this part of the population to their to the winds, really. Yes, some clinical services are excellent. Yes, some places have superb support, but there are vast deserts where there's nothing. And it is my belief that coaching people through that and helping them is something that through technology we can now do, and we can now do in an affordable way. So give it a go.